Good afternoon and welcome to our daily medical briefing. Today we're going to be hearing from Supervisor Nathan Fletcher, our co-chair of the Board of Supervisors Subcommittee on COVID-19. We're also going to be hearing from Dr. Nick Efantides, who is our Chief Medical Officer. And today we have with us Bill York, who is the incoming President and CEO of 211 San Diego. I want to start by talking about our case numbers. As many of you saw or heard, our case numbers have taken a big jump since yesterday, up to 417 now. And I'm sure that they're going to jump again when we report out at the end of the day. Sadly, our deaths have also been increasing. For weeks now, we've been stressing the importance of social distancing and staying home, and that is why we've been repeating that message time and time again. It's also why we're extending our public health order, which you'll hear more about in just a moment. Prevention is the best medicine to fight this virus. To end this crisis, we've got to stop the virus from spreading, and that means staying home, avoiding physical contact with other people, and washing your hands. In this battle, we are all soldiers. I know it's frustrating when you have a beautiful day like today, and you want to get out and enjoy it. But I know it's also in the DNA of San Diegans to head out to the beach and parks, but we need you to be strong. We need you to be less like San Diegans and, well, frankly, more like North Dakotans that get all wrapped up for the winter and stay indoors. No offense to anybody from North Dakota. Again, it's okay if you hang out in your backyard, your front yard, your garage with the door open, or even take a walk around the block. But please don't head out if you don't have to. Lives truly depend upon it. Now let's get to our speakers. We're going to hear first from Supervisor Fletcher about our updated public health order, from Dr. Efantides on the medical update, and today we have a new guest, Bill York, that I mentioned. The incoming president and CEO of 211 San Diego is going to talk about what 211 is doing to connect people to those services that they can benefit from. Supervisor?
Thank you. Our message today to the public is just that. Stay strong, be smart, and comply with the orders. As we have stated multiple times, and we will continue to reiterate, the situation in San Diego is only going to get worse in the coming days, and the actions that we take now will impact the severity of that increase. Today is the single largest jump we've had since the outset of this, with 76 new cases, putting us over 400 total cases, tragically including 7 deaths. While this is not unexpected, it should be a wake-up call to the public to heed very seriously the public health warnings and orders that have been given, and we really are asking for the cooperation of everyone out there. If you are a non-essential business, you should not be open. If you are an essential business, you should be adhering to social distancing and proper hygiene, and we are strongly encouraging the public to stay at home. It is okay to go outside and to exercise and to be outdoors. We just need you to do it responsibly with your family unit, not having any physical contact or interaction with other folks. And if we will do those things, we believe that we can positively impact the curve while we simultaneously bring up the healthcare system to move forward. But we need the community, we need each and every one of you to really commit, to buy in and join with us in these efforts to slow the spread and slow the infection rate. Today we are issuing a public health order revising our previous orders. They were scheduled to end on March 31st. The revision to the public health orders are extending them indefinitely until further notice. This action is in line with the increased severity of infections, hospitalizations, and deaths that we see, and also in recognition that we are going to be in this posture for a while. None of us know exactly how long it will last. We don't know exactly how many cases we will have or what day that we might hit the apex or the flattening of that curve. But what we know is these early days, and we still are in the early days, are the most critical and the most important. And so if you are a school, that means all of the orders that were presently in place through March 31st are now extended until further notice. This applies to the closures of schools, non-essential businesses. This aligns us on a timing basis with the governor's executive order. It also means that the impact on restaurants, gyms, fitness centers, government entities all remain in effect until further notice. We also want to remind the individuals the obligations around daycare and childcare are all extended as well. And then the absolute strong recommendation that all persons who are 65 years or older who have a compromised underlying health condition quarantine themselves at home. And we will continue to work to implement these, but we are asking for the public's help and support in carrying out the orders that have been given. I also want to mention briefly the governor did 2 executive orders yesterday. The first was one on evictions. His order tracks closely with what we did in the county of San Diego, with the only difference being the governor's order only covered residential properties, where the county's covered both residential and commercial. And second, the governor's executive order gave the Chief Justice the ability to provide uniformity in extending deadlines on trials and other arrangements. The Chief Justice is currently developing how this will be implemented, including in the San Diego region, and we would encourage you to stay tuned for future updates. Quickly, we will go to our 2 charts to reflect new cases along with testing. The first case you see here represents the 76 new cases we are presently reporting, bringing us to a total of 417. And the second one reflects the increased testing. Yesterday's testing reporting 1,023. We want to be clear that we do not believe this represents all testing that is being done in San Diego County. We still are working with all of our community providers and labs to ensure that they comply with our public health order, that all tests, both negative and positive, be reported to the County of San Diego. We are confident that all positive tests are being reported, but we will continue to work, and we hope and expect this number of testing continues to increase. I think it is worth noting that in the last 2 days we've reported a greater testing capacity in San Diego County than the 4 previous days combined. And so testing is heading in the right direction. And we will continue to see increase in cases, both as we see increase in community spread, but also as we continue to become more aware because there is more testing that is out there. Now I'd like to turn it over to our Chief Medical Officer, Dr. Nick Impatides.
Thank you so much, Supervisor Fletcher. As we continue to talk about our regional population, it is the reality that our population is comprised of individuals. And as already mentioned, unfortunately, I have to announce the death of another fellow San Diegan, a man in his 80s who had underlying medical conditions, has passed from complications of COVID-19. This combined with yesterday's announcement about a San Diegan, young man in his 20s who died in Riverside County, will bring the death total for San Diego up to 7. And just these 2 deaths reflect the sober reality that we are facing, that COVID can affect individuals at all ages. As has become our routine, I would like to now go through the breakdown of the different categories, and being mindful, by the way, and expressing my sincere condolences and love for the members of our community who've lost their loved ones. Globally, the novel coronavirus has resulted in 615,000 cases and now over 28,000 deaths. Nationwide in the United States, we are now at over 116,000 cases with around 1,800 deaths. As has been said before, the United States has now taken lead of all countries in the world with the greatest number of both cases and deaths. In California, we have nearly 5,000 cases and 104 deaths. And as of the 5 p.m. Reporting time yesterday, as you have already heard, we have 417 positive cases here in San Diego, with what we will be reporting today, 7 total deaths. Of the 417, 63% are between the ages of 20 and 49, 40% are female, and 60% are male. 18% have been hospitalized, 9% have been admitted to the ICU, and with the new deaths, that will bring the total to just over 1%. An area of particular interest continues to be the congregant living facilities, and I just want to give a comprehensive summary of them. The current situation and overview of nursing homes and long-term care facilities. We have 12 nursing homes and long-term care facilities that are being investigated. 5 of those have been ruled out as not confirmed outbreaks. We have 3 confirmed outbreaks in 3 facilities, and there are 4 facilities where there is still ongoing investigation. In terms of responding to those facilities and all of those outbreaks, we have a very consistent and well-established protocol that we continue to follow. Last thing I'd like to just touch on is the evidence of our system's capacity. Folks, I think as a result of some of the things you're going to hear momentarily, we have lots of data. Just as a couple examples, we compare the rate of ambulance transportations year over year, what we call pre-hospital transport. Those are meaningfully low. We also, among many other things, look at the percentage of certain kinds of beds that are available, intensive care beds, beds that are negative pressure beds and so forth. The percentage of availability of those beds actually continues to creep in the right direction, which is more. And then we also follow overall total numbers, hard numbers of ICU beds, negative pressure beds, telemedicine, med-surg beds, and all of those indicators are in a very favorable direction. But a reminder, that is because we are positioning ourselves proactively and are in the phase of the calm before some level of expected viral storm. It takes a community, and I'm so thankful to now introduce my brother and my friend, Bill York, who is the new president and CEO of 211 San Diego. Bill, the microphone is yours.
Thank you, Dr. Nick, and good afternoon. Thank you for the opportunity to share a little of what 211 is doing during these times. As many of you may or may not know, that 211 is a local nonprofit organization dedicated to connecting San Diegans to vital community health and disaster resources. Our staff are here to answer the call 24 hours a day, 365 days a year, and we are your trusted source of information and referrals. And with the help of our partners, we keep the 211 database up to date with programs and services with over more than 6,000 services. Our searchable database is also available online at the website www.211sandiego.org, or dial to speak to a live person in more than 200 languages. During this unprecedented time of COVID-19 pandemic, our team is here for you. We are partnering with the County of San Diego's public health services and local healthcare systems to get critical public information, COVID-19 information, transferred to one of 60 county public nurses. The nurses are available 7 days a week from 8 a.m. to 8 p.m., and they can answer clinical questions about COVID-19 symptoms and the best course of action to you and your family. After hours, you can leave a voicemail and the nurses will call you back within 24 hours. Dial 211, and after the language selection, press 1 and you'll be directly transferred to those nurses' line. Since launching the public nurse line 11 days ago, we've taken over transferred 1,625 calls to that nurse triage line. We understand that COVID-19 has impacted every facet of our lives, and we can help you with other services. By working with our partners, our County of San Diego, we can also help you with critical resources like public benefits, benefits around CalFresh, enrollment, Medi-Cal, food assistance, food banks, food banking, food pantries, and mass distribution sites, utility assistance and any type of new assistance coming online, housing assistance, rental assistance, mental health resources, access to the Access and Crisis Line by warm transfer, financial and employment information, and senior services and in-home support services. If you need any of those available resources, please visit our website at www.211sandiego.org or follow us on Twitter or Facebook. Or if you'd like to talk to a person live, call 211 at any time. San Diego 211 is here for you, and we're in this together. Thank you. I'll turn this back to Chairman Cox.
Thank you, Bill. Now we're going to go straight to the calls. I believe we have three calls waiting, and we'll go ahead and go with the first one. Again, if we don't state your name and your outlet when we ask you to go ahead and start speaking, please do that. We'll take the first call now.
NBC7, will you please state your name and question?
Erica Cervantes. We have received a couple of calls into the station that 5 crew members from the Disney Wonder ship at the Embarcadero and that 3 grocery workers have tested positive for COVID-19. Are you able to confirm any of that?
Okay, Dr. McDonald is going to answer that question. He is our medical director for our county epidemiology and immunization branch. Dr. McDonald?
If you could repeat the question about the cruise ship first, I just didn't hear it distinctly when I was over in the corner.
Sure. We've gotten a couple of reports that 5 crew members on the Disney Wonder have tested positive. We were wondering if there's any truth to that.
Well, the reason that the Disney Wonder cruise ship, the reason the Disney cruise ship is back in port is that they did have a crew member that needed evacuation and treatment at a local hospital. That individual is the only person that has tested positive for COVID on that ship. We're working closely with the ship's medical to be sure that the rest of the crew is healthy. And the other question was?
We've also heard that 3 grocery workers, I believe one worked at a grocery store, one at a pharmacy, and one in a grocery type role have tested positive.
That's a great question. Thank you. We do follow the occupational and roles of each of our individuals who are positive for COVID. We've had a couple of pharmacy technicians who have tested positive, and we're working with those locations to identify close contacts and be sure that a proper infection control was performed, that there were no exposures on those sites. Specifically with grocery workers, I can't address that one specifically, but I will get back to you on that.
Okay, next question.
Union Tribune, will you please state your name and question?
Hi, yes, Wendy Fry, San Diego Union Tribune. My question is about cross-border coordination between health agencies in San Diego and health agencies in Baja California. Have you guys, is there any CDC liaison assigned as far as doctors? I know that there's been phone calls between the governor and the mayor and stuff like that, but I'm talking more on the medical side, doctors who are addressing how this virus might be spreading across the border.
Okay, Dr. McDonald answered that question.
Sure. Thank you for that question. It's a chance for us to highlight the very close work that we've had actually for years with our colleagues in the municipality of Tijuana as a part of this binational region, and also with our colleagues at the state and Baja California. We do get all of their information on the daily updates on the number of cases they have there, the number of cases that are pending, cases that may have some cross-border involvement, that is, an American citizen who's diagnosed there who comes across, or vice versa. But we have a standard process that we use with our colleagues in Baja California via the state binational disease surveillance system and our Office of Binational Border Health at CDPH. There's, again, good connections. And also, frankly, there are a lot of connections between institutions on both sides of the border, whether it's medical institutions, individuals who actually practice on both sides of the border, and there has been active exchange between us and our colleagues, particularly in Tijuana, that is very similar to the conversations that are going on between the healthcare organizations here within San Diego.
What about the CDC? I believe during the swine flu, there was a CDC liaison assigned, like specifically as a border liaison. Do you guys have a doctor set up for that yet or not? No?
Well, you're asking a question about the federal government to a county employee. I'll tell you that we work very closely with both the CDC quarantine station, who have physicians and nurses and experts actually physically co-located with us in the county. We work with them on a daily basis, and so we share information literally daily. But if you're asking a question about the CDC, you should ask the CDC.
Okay, thank you.
Okay, we have one more call-in question, and then we'll go to the one text question that we have. But again, if you have additional call-in questions you want to make now, it's a good time to do it. If there's any more text questions, please get those in, and we'll go ahead and take the last calling that we have right now.
KGTV 10 News, will you please state your name and question?
Hi, Vanessa Van Hefty, 10 News. I have a clarification first and then a question. In terms of the numbers today, are the 76 new cases part of the 417, or will those 76 be added when the new numbers are released later today? So just a clarification first, and then I have another question.
Those are part of the report from last night. So there will be additional numbers that will be added at 5 p.m. today. And your other
So
question?
76 new cases are part of the...
That was the number that was reported yesterday, the 417. Yes. So, yes, they have been counted already.
Okay. And then in terms of the nursing home, are you releasing the name of the nursing homes? Have the relatives of those patients been notified?
Supervisor Fletcher is going to answer that question. Or Dr. McDonald.
Sure, I'll answer that question. Again, it's similar to a question that I received yesterday about naming specific facilities from the public health perspective. We give information to the facility, sorry, I'm always looking over there. We give information to the facility about the condition of their either staff or patients and work with them to be sure that all of the appropriate individuals are notified. Again, physicians should be the ones that are notifying patients and usually patient families. It's usually the physicians who order the test, but we work with the facility to make sure that the individual congregate living facility community is aware of what's going on with each facility.
That completes the call-in questions. The one text question, I think, is a question that's going to be answered by Dr. Ifantidis.
Yes, thank you. And many of these have been asked already, but Dr. Ifantidis will answer them. This is from Andrew Nomura from Fox 5, and he asks, do you predict the daily jump in the number of cases to continue to go up?
The question in terms of what we expect in the total number of questions to go up is absolutely yes. There is two things, I think, going on at the same time. Most importantly, as we continue to say on a daily basis, the extent of local transmission is increasing, and as we are starting to see the increase in the number of laboratory tests that we are performing, you combine those two things together, absolutely the numbers will continue to increase.
Where do you see a possible peak?
A possible peak, I wish I was a prophet instead of a doctor, in the future. I think it is, we have lots of modeling and things that we have talked about, but based on, again, the tip of the iceberg and the test limitations and so forth, it is likely that the peak will come in the coming weeks.
Health officials have called on people to take social distancing more seriously and with stricter guidelines. What does that look like?
Well, look, folks, you know, based on what we are already experiencing, I hope we are as serious as can be. But in terms of options that are available, there are some additional things that could be done. There are parts of the country, or in certainly parts of the world, where things like curfews, potentially the number of times that folks leave their home during a week and so forth. That is not something that we are planning per se today, but they are on the radar as options that are still available based on the data and the evidence as to whether or not such additional measures will need to be taken.
And do you see restrictions tightening up or loosening up?
I believe that if we are going to do anything in the immediate future, it will likely to be to maintain where we are with hopes of optimal compliance by our local community. If there is an action in the short term based on where we are and the peak being in front of us, I can't imagine that it would be anything other than perhaps some additional considerations being to the ones we already have.
And finally, what is the situation with the hospitals right now? Will they be able to handle the caseload?
Yeah, you know, for me, that is one of the real blessings, I will say, of this whole challenge that we are facing. I've said it before, but I have to repeat it. I have never seen the level of cooperation, collaboration, integration, and a spirit of unity that we have, not just at the medical level, but with our entire community, our faith-based community, our community-based organizations. We are having intensive, meaningful meetings, and the evidence points to the fact that hospital capacity right now is as optimal as it can be. And all of this is proactively designed for us to, again, prevent the preventable, so that we as a region can be poised to deal with the inevitable. Thank you.
That concludes our call-in and text messages for today. And I know we've given you a lot of information today and over the last 2 weeks, but if you need reminders or need to find resources, we would encourage you to please visit our COVID-19 website, which is at coronavirus-sd.com. We have a slide we put up now that is referencing something that I mentioned yesterday. We've added a great new resource, the Live Well at Home webpage. This resource is for people of all ages and with learning tutorials, with videos, with activities to help you stay both physically fit and mentally healthy during this crisis, and I urge you to check it out. You know, we're all at a point in time where you need to do what you need to do, and what you need to do right now is to stay home, to wash your hands, to keep that social distance of at least 6 feet. If everybody can do that, we're going to get through this crisis a lot quicker. And again, remember, live well, stay well, and in order to stay well, stay at home. That concludes our event for today, and we'll be back here again tomorrow at 2:30. Thank you.